Hi, my name is Kristen Hutchinson, and my presentation is on environmental and cultural factors for those with autism. Cultural environment. So we're going to talk about the media. Modern media portrays those with autism as very high functioning autistic, and this is inaccurate for this population as a whole because autism falls on a spectrum and it depends on where you fall on that spectrum. This can place individuals with autism at risk for misunderstanding. People may be expecting them to be higher functioning autistic than they are based on how the media portrays them. And people may not believe their diagnosis or the diagnosis of a loved one due to what they understand autism to be. Family support. Studies show that children with ASD reported lower health care quality than children with special needs or children with functional limitations. Children with autism are more likely to have poor health care quality than other children when there's adverse family impact. Rules of peers, so this can go either very negatively or very positively, and there's negatively 2/3 of children between the ages 6 and 15 will be bullied. Those with a higher perceived social support from friends and family had better health-related quality of life. However, overall, this population reported lower physical and mental health outcomes than other populations. 7% of this population struggles with depression and suicidal tendencies. 28% of children by the age of 8, have self-injurious behaviors such as headbanging, biting, and skin scratching. Autism is genetic. Parents who have one child with autism have 2 to 28% chance of having a second child with autism. Identical twins, if one child has autism, then the other has a 36 to 95% chance of having autism. For non-identical twins, if one child has autism, then the other has a 31% chance of having autism. Vaccines do not cause autism, although that was speculated in the past, and it does affect generations because it is genetic. This population is vulnerable, and with that comes recurring vulnerability. 33.3% have a physical illness on top of autism. This includes GERD, gluten intolerance, ADHD, anxiety, and epilepsy. 36.8% have an additional mental illness. The most popular are schizophrenia and bipolar disorder. Feeding disorders, so they struggle with inadequate nutrition and amount of nutrition because they'll only eat certain categories of food and completely ignore other vital food categories that are. This population is at risk for all forms of abuse and self-harm. Children are at risk for drowning. 90% of deaths of autistic children are from drowning with this population. Legally, federal government regulates certain aspects of autism therapy in public schools, special education programs, and schools can't help with behavioral management therapy for autism due to how expensive it is. Families often have to have a private insurance to cover all the treatments. Some states have mandated that insurance companies cover needed autistic services, and that's mandated in 40 states, and that includes Utah. So potential barriers for the family that can include limited financial resources and knowledge of autistic services. Culturally, some believe that it can be cured by faith or that it's a gift from God. Others have a negative outlook, and we'll go over that in the next slide. Language barriers. There's a language barrier if there's a different language spoken by the patient or family, and those with autism for a different reason because they may not understand what is being said to them because autism is a cognitive impairment. When there's a negative stigma, this negatively affects autistic individuals and their families because they tend to isolate themselves from others. Internationally, African cultures believe that mental disorders come from ancestral spirits or the devil, and that includes autism. South Korea has a negative stigma causing parents to delay in getting their children diagnosed, even though those delays are present. And some beliefs say that autism is present due to sin, paternal misdeeds, or witchcraft. Others have a belief that autism is given as a blessing and is a way of showing that the parents are worthy to take care of such a special child. Social economically, this population is in a lower income bracket because less than 50% of those with autism have a full-time or part-time job. That means the other half of the population doesn't work at all or works very, very little. And this can make it hard to pay for bills or pay for their treatment. Educationally, 37.5% have completed high school or college. That means that majority of this population doesn't have a higher education. And this can affect their income status as well as how much they know about autism itself. Race and ethnicity. Autism affects all ethnic and social economic groups. More white children have been identified with autism than Black or Hispanic children, and that can be due to a lack of healthcare services, low income, non-citizenship, and language barriers. And the best thing for this population or community is an increased awareness to promote earlier diagnosis and treatment, because ultimately that's what's going to help those with autism. Religion. Studies show that religion involvement can enhance patient outcomes. Spirituality and religion can strengthen one's resilience in life, and religious involvement helps with depression, bipolar disorder, suicide, post-traumatic stress disorder, also known as PTSD, social support, and psychological well-being. Many of those with autism struggle with these conditions above. Having to support a religious group and spirituality can have a positive outcome on most patients. Gender. Autism affects all gender. Autism is a lifelong disability. It affects more men than women by 5 times more. And there's a lot of debate and need for further research. So there's debate as to whether females display the autistic phenotype differently than males. And if that's the case, then they may benefit from an adjusted autistic criteria. That way that more women that do have autism can be diagnosed with it. And then male biases in autism may be due to behavior or symptoms displayed or comorbid intellectual disabilities. And there's some studies that show that females have a protective factor genetically against autism. Geographically, due to the small percentage of the autistic population having jobs, lower income status, and therefore where they live is affected. So transportation barrier. Low income neighborhoods may not be close to hospitals or specific treatment facilities for autism. As a result, I believe that telehealth and telemedicine could help reduce those concerns and provide a broader reach to all those who are diagnosed with autism. And that includes schools. So earlier we talked about how schools can't provide behavioral management treatment due to how expensive it is. With telehealth and telemedicine, I believe those expenses could be reduced, and then children in schools can get that treatment. So there's implicit biases and explicit biases. There was a study done that shows that participants had negative implicit biases against autistic adults, regardless of stereotyping. And this means that the participants may not have been aware of these biases. And autistic adults report feeling discriminated against, socially excluded, humiliated, and neglected, and it could be because of those biases. Explicitly, the same study stated that participants had positive explicit biases. This means that the participants stated that they would support and be inclusive to this population. Internationally, not all countries recognize ASD. They don't screen for it. There's 1 out of 160 children that are affected by autism globally, and that's from the World Health Organization. But Autism Speak suspects that there's 70 million people out there with autism, and that's due to all the different countries that don't report autism or don't screen for it, or that's counting all those who aren't diagnosed due to the negative stigmas or inadequate health care. And these are my references. Thanks for watching.